Hey everyone, welcome to today's Facebook video. I had some more problems with Facebook Live, so I'm sorry that it's not live streaming and I just had to upload the video. This is week 3 of our 12 weeks with the hip dysplasia tutorials. Just wanted to remind you guys that it's every Wednesday at 12:30. As much as possible, I'd like to be live, but every now and again we have a few technical issues. So if it's not live, then I'll be posting the recording. So just a quick recap from tutorial 2. We looked at the causes of hip dysplasia, so other causes. We looked at things like spaying and castrating before and over a year of age, and how if we do this before, we have delayed growth plate closure, and this can cause problems such as hip dysplasia and cranial cruciate ligament ruptures. We also talked about puppies and how they must be able to move around and walk on different surfaces to promote muscle development, because that muscle was really important to prevent any laxity in the hip. We spoke about stairs, and pets that are less than 3 months of age shouldn't have access, so puppies and kittens shouldn't have access to staircases because they can fall and really hurt themselves, and this can damage all those tissues, and they've found from studies that predisposes them to hip dysplasia. We also talked about our goals, which we're going to recap again today, and we talked about compensation as well and the consequences of that. We did our 2 exercises, which is weight shifting and slow leash walking. I hope you guys are getting on with those well. If you have any questions, please post them in the comments below. And then we spoke about terrain and saying that the beach is out. If you missed anything there, you can scroll down on the page and just have a look at the recording. So just to remind all of you what our goals are. So we want to decrease pain. We want to maintain our joint integrity, so maintain as much cartilage as possible. And we want to improve the stability of our pet's hip so we don't have any laxity, because we know that when we have laxity, that's when we get hip dysplasia. So on the weekend, I did a webinar with Peter Dobius, and we streamed it live. It was about 2 hours long. And this is one of the slides from that webinar. And it was on natural ways to treat pet arthritis. But the slide is so applicable to pets that have hip dysplasia too, because any pet that has hip dysplasia is very likely to become osteoarthritic in their hips as they progress. And the one thing that I wanted to talk about is that often we jump very quickly to medications. We want a pill or something that is going to sort all our pets' problems out. But these are all the things that we should be doing before. We should be looking at their weight, look at their nutrition, supplements, environmental changes that we can make to help our pets to decrease pain, discomfort, improve muscle development, rehabilitation and exercise. So rehabilitation therapists that do therapeutic exercise, as well as the ones that I'm going to be showing you, hydrotherapy, all different types of treatments to help minimize your pet's discomfort and pain. And then we'll look at alternative therapies like acupuncture, maybe going to see a chiropractor, magnetic therapy. We're going to go through some of these today. But before you jump to that medication and surgeries and treatments, these are all the things that we should be trying. And you know, as much as possible, I'm going to try and see if we can get through a lot of these in the 12 weeks. There is loads and loads and loads of content that I could chat about. A lot of this we'll also be covering on the Online Pet Health Academy webinars. But if you want to have access to that 2-hour webinar that Peter Dobius and myself did, you can go to drmegankelly.com, and if you go to the recorded webinars, there's actually free access to that 2-hour webinar. So you can click there. There was loads and loads of information that both Peter and myself shared there about treating pets with arthritis naturally. So talking about relieving pain, so there are lots of ways we can use medications. We can use all these different things: magnetic therapy, massage, acupuncture. So many different ways in which we can relieve pain. So I'm going to focus on the more natural ways. Today we're going to talk about magnetic therapy. We're going to talk about massage. I'm going to show you a very basic back massages you can do with your pets. A lot of pets that have hip dysplasia have a very tight back, especially the paralumbar muscles, which are the muscles on either side of the back. I'm going to chat a little bit about acupuncture. You need to be a vet to be able to do acupuncture. But next week, I will show you how to do acupressure, and I'll show you the specific points that you need to use for pets with hip dysplasia. And I'm also going to chat a little bit about gold bead implants, and we'll chat about a case study or clinical study that's been done using gold bead implants. So secondary back pain. So do you remember the first week and second week, we talked about compensation and how when our pets have some discomfort and weakness, they alter the way that they walk and they alter the way that they stand. And say, for example, with Sunshine, she has got pain in her left hip. What she does is she shifts most of her weight onto this right front. So what we see is she's very tight, usually in her left lumbar area and her right thoracic area. So that they're two long strips of muscles that go on either side of the spine. So it doesn't show up really nicely in this video, but towards the end, you'll see some flicker actually over there. So she obviously gets treatments from me regularly. So this area is usually very tight, and she doesn't actually seem to be flaring up here today, but you'll see other areas, and especially in her thoracic area, and that's really from her overusing her front legs. So instead of pushing up with her back legs, she overuses her front and her back, causing this compensatory pain. And this is what we're going to, I'm going to show you how to do a basic massage just to help with that discomfort there. So let's have a look at the video quickly. So one way you can test is if you just very gently, you just push on all the way along. You can see there was a little spasm there. Oh, there's a big spasm there. You see she's really tight there. So that's a way in which you can determine whether your pet is a little bit uncomfortable and where they're sore. To the trained eye and trained hands, we can actually feel muscles that are tight. So this takes a while, and the more you massage, the more you will realize that feels tight, that feels soft, and what's okay and what's not okay. And you'll also get to know your pet. You'll get to know areas in your pet where they usually are sore, and you'll probably just go straight there to massage without even needing to test. So what are the benefits of massage? Well, when a muscle contracts, it pumps blood out of the muscle. As it relaxes, then blood flows into that muscle. And it's important that the blood comes and goes, because the blood that's coming in is bringing oxygen, and the blood that's going out is removing all the toxins. So when muscles are tight and in spasm, they're in this continual state of contraction. So that means that no blood is coming in and out of that muscle, or very little, should we say. And what happens is toxins start to accumulate and the oxygen levels in that muscle decrease. And that muscle in that continual state of contraction actually becomes fatigued, and it can't actually perform its job properly. And when we discussed muscles, we talk about muscles are important for movement, but as we know, especially with hip dysplasia cases, they're actually very important for hip stability too. So we don't want these tight spasming muscles, because that means that they're not going to be able to perform their job properly. So by massaging, we can relax those muscles, we can increase the blood flow to them, improve the oxygen supply and the removal of wastes, stimulate endorphin release. Now, endorphins are the body's natural healers and natural pain relievers. And endorphins come into play also when we're doing acupressure as well as acupuncture. And then venous and lymphatic return, it just helps with removing all the blood that's inside the muscles back to the heart. And improving the range of motion of joints. So when muscles are tight like that, you can imagine that the joints themselves will not be able to move freely. So when we relieve that, we actually improve their range of motion, which means their ability to bend and straighten. And with that, we improve their mobility. So here is a very basic exercise on how to, or example of how to do a back massage. It's called compress and release, and you're basically going to use your thumbs and you're going to push and compress and then go gently outwards. So we're going all the way along those paralumbar muscles, paraspinal muscles, and just helping every time we push and compress, we're helping to push some of that blood out of the muscles and helping to relax the muscles. Where the handler is pointing now is along the spine, sunshine. We don't want to push on any of the bones. That'll be uncomfortable for your pet. So you really want to go on either side of the spine, just on those muscles and on either side of the bony areas. Now, I have a massage course which you can see on drmegankelly.com. My online Pet Health Platinum members have free access to all the online courses on the website. And I wanted to show you while I was talking about this, a little picture that was me massaging Sunshine. Yeah, so there's loads and loads of information, all different types of massage techniques. There are 4 different massage routines, including a warming up and a cooling down routine. And then we also look at a relaxing type of massage. So for those, if you have got maybe some anxious pets, and then we'll also do sort of a maintenance one, and that would be the one that we would be looking at for our hip dysplasia cases and any of our patients or pets that have arthritis. So you can go to drmegankelly.com and you'll be able to see all of those there. Oh, it went. Okay, acupuncture. So this is something that I do in a lot of my patients, and it is one of the treatments that I really, really like for my hip dysplasia cases, because they, especially when they're very young and they get diagnosed, they can be quite painful. Once things start to stabilize, usually about 10 to 12 months, then their pain starts to decrease. But if they're diagnosed really early, we can really, really help with their pain management and start to build muscle. And it's important that we do manage their pain, because if pets are in pain, they're not going to use their bodies correctly. And we want to try and build all those muscles around the pet's hips. And if they're uncomfortable, they're not going to be doing the exercises effectively. So acupuncture basically is inserting very fine needles into acupuncture points, and these are little points along meridians along the body. There are different types of acupuncture. So you get sort of the Western scientific approach, and then the Eastern Chinese approach. And I practice Western scientific acupuncture. So that means that what I believe in is that by putting the needles into these points, it stimulates the release of endorphins and all natural pain relievers and healers in the body, and it blocks pain pathways back to the brain. So we have a scientific reason of how the needle stimulating the acupoint works. So pet owners obviously can't do acupuncture, but they can do acupressure, and that's something that we're going to cover next week. So gold bead implants, I really like this for younger dogs, especially the ones that respond really well to the acupuncture. It's like a permanent form of acupuncture, and you'll see these little gold beads here, all these little things here. Basically what they do is they use like a needle, and they'll do it under anesthetic in a sterile environment, and they'll put these little gold beads into the acupuncture points, and so it continually stimulates those acupoints, so it continually causes that endorphin and serotonin release. Here is a picture, and these are courtesy of AccuVet in Kenilworth in Cape Town. Dr. Barry Heinmarch, he works there, and he does lots of gold bead implants. So in a study that was done, actually looked at gold bead implants specifically with dogs with hip dysplasia. And they had 78 dogs, and 36 of them they put the gold beads into, and 42 were placebos. So basically the placebos are ones where we just pretend that we put a gold bead implant. So they'd probably just have a needle that would be put into that point. There were 5 different points where they put them, and they used 24 karat gold beads. And in the placebo, they put them into, just use the needle and just put them into put the needle into non-acupuncture points. And they did assessments in them 14 days, 3 months, and 6 months. And then did a questionnaire and lameness evaluation for the vet, and they also looked at the owner's response. And the results were that they actually found significantly greater improvements in mobility and a decrease in pain in the dogs that had the gold bead implants. And if they had to have scored the pain scale, so the vet did a pain score, and they looked at on a scale of 1 to 10. The initial pain score was 5.3, and after 6 months with the gold beads, it was reduced to 1.9. So really just showing that these gold bead implants really do work, and especially I will refer patients that have having acupuncture and seeing a good response, then I'll refer them for gold bead implants so we don't have to continue treating them with the acupuncture. So let's go on to week 3's exercises. This is called the weight shoves exercise, similar to the weight shifts exercise, but we're going to be shifting the dog's weight onto the front and then onto the back. This is one of my favorite exercises. It's an all over body workout. And when you watch this video, I really want you to just see all the muscles contracting in the body. And you can see how we are challenging the muscles, getting them to strengthen in a very, very controlled fashion. See how we're shifting forward and back. You can see all those abdominal muscles, the front leg muscles, and the hind leg muscles. Now, what you can also do is you can go from the diagonal. So you can see now this dog, we're going onto the right front. You're probably going to be wanting to push the other way onto the left hind, because a dog with hip dysplasia is going to be already shifting their weight onto the front. So you're going to go from the left front to the right hind, or from the right front to the left hind. And you can do that 20 times, 3 times a week. So this is the side bends exercise. This is a great exercise to increase weight bearing on the hind leg, to activate those muscles or extensor muscles. And it also helps with flexibility in the spine. You can see the handler here has got her left hand on the dog's hip there. So when you turn around, the dog will tend to just go in a circle if you don't prevent them from moving the hindquarters out to the left. And you can see here she's doing it on the right hand side. So bending around, basically feeding her little treats as close to the hip as possible, and that increases weight bearing on the hind and just stretches out the back all nicely. All right, so that's the end of this tutorial. What are we going to learn next week? We're going to talk about herbs and biopuncture and a product that I use called Caprex. So that's going to be the end of our natural ways to manage pain. We're also going to give you some acupressure technique and points. We're going to talk about diets and the benefit of omega-3 as an anti-inflammatory. And then we're going to go on to the week 4's exercise. If you guys have any questions, please just post them in the comment section below. Let me know how you're enjoying the tutorials, and also just introduce yourselves. Tell me where you're from. It's been awesome seeing all the people on the Online Pet Health Academy. We've got people from Kenya, from Canada, from the UK, all over Europe, Australia. I love to hear where you guys are from and where you are with your pets, and doing all the exercises and how you're getting on. So for those of you that are interested, on the 14th of February, I know it's Valentine's Day, so those of you who are not big into going out for dinner and celebrating Valentine's Day, you can attend this webinar. It's a guy called Ben Blecker. He's such a great guy. I haven't ever met him in person, but chatted to him online loads. He's got an awesome business called Go Hero, and they make orthotics and prosthetics for pets. And he's going to be chatting to us about realistic expectations and what is reasonable for pets that have got amputated legs, how we can help them, and how he can make braces and supports just to help their joints and to increase their mobility. So you can get access to that at drmegankelly.com. If you sign up for the Platinum Online Pet Health Academy, you get free access to all the webinars, as well as the recordings 365 days a year. So if you just want to access this, you can also just go on a pay-as-you-go way. So thanks so much. Have a wonderful day, and let me know how you get on with all the exercises. Thanks. Bye.